Hey, NerveSpa fam, Scott here. I have the pleasure today of talking with Dr. Tim Kammerman. Tim, owner of Chiropractic Care Clinic. And today we are here to chat about our NerveWave. Tim has been using this for a few months or so. So kind of just want to get his feedback. And before I open the floor, just to be more specific about this, the NerveWave has multiple protocols, four main ones, in fact. There's one for neuropathy, one for regenerative pain control, one for restorative recovery, such as muscle-related issues, post-op, that sort of thing. And there's also one for vagus nerve stim. So first of all, Tim, welcome. Thank you for doing this. And
Welcome.
tell the audience at home which protocols you all have been focusing on using the NerveWave.
Okay. So, some different things. And, a conversation we had a few weeks back was that when you've been in practice for a while, I've been in practice, it'll soon be 38 years in September, and you have different techniques, you have different pieces of equipment that you have confidence in. When something new comes along, you start asking uh, a couple of questions, and one is, do I already have similar electrical therapies that do I need this? And so
Mhm.
you ask that question, and then is there something that is a little bit different or a feature that's on there that differentiates between the other therapies? So that's what I look at. And so when you're used to being in practice and you're going through your protocols, it's hard to just stop and add something unless you feel it's going to make a difference in your practice. So when you started talking to me about the NerveWave, there was a couple of things that caught my attention. Um, and I'm looking over here to the right because I'm looking at the screen. And so a couple of things I like before I talk about the programs that we use a lot more is the majority of the equipment that we have in the office, um, it has to be plugged in the wall.
Mhm.
Okay. So, it's fine for usage here. There's some of those therapies that I have taken home, loaded
Right.
up in my truck and take it home and use it on myself, my wife. So with the Nerve Wave, I like because it's portable. You can charge it up and use it more mobile. You can put it in the case, take it with you, and so certainly you can plug it in and recharge the battery. But I like it because it's also mobile. You
Oh,
can take
cool.
it with you on vacation or whatever. So that's a good feature. Um, the next thing is when you first look at it, there's so many programs that are available
Mhm.
that it at first it looks kind of overwhelming, but once you use it a time or two, it really is easy to navigate through. Like you said, there's the regenerative pain control. I've used that personally on some different areas. I like to play. I like to play some
I know,
pickleball.
man. You are
So
curious, dude.
so at my age, I get some aches and pains. So I use different devices, and I've been using the NerveWave. It has the neuropathy protocol, which I'm going to love for my patients going forward because we've done a lot of work with neuropathy the last 15 years at least, and so using a lot of therapy. So I like having an additional tool. A couple areas that we have used is now I always, I'm from Arkansas, so I called it gua sha. Now I'm just like, okay, I guess it's gua sha. But I carry a tool similar to this in my pocket. I've done that for 2 or 3 years, and I use it on different areas of fascia.
Right.
I use it on the hand and things of that nature. So when you start talking about this as a accessory to the nerve wave, it got my attention really fast. And
I
so
remember that. And hey, and just a reminder, this 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 scraping tool, it comes with the package. It's not an additional cost. it's part of the whole kit and caboodle, so to speak.
Well, I will tell you this. Um, all the other programs that are in there are great and amazing. So just to have this as an additional tool in some cases, for example, I've got a gentleman that comes in, he's got disc problems in his neck, he's got radicular pain at times, he's been through shots,
Mhm.
he's had lower back surgery, so he's just a mess. And so when we use this on him one day in the uh, lower neck and shoulder area, he was amazed. I just saw him again this week, and he's a lineman, so he does a lot of physical work. So when he came back in, and we did some of the other techniques, and then we pulled this out and did the washa on him, it makes a huge change. Now, here's the cool thing is you can play around with different programs. So on him, a lot of times we'll scroll down to the manual program, and then we'll use the EMS mode on him, and that one works real well. And you
Hey,
can do
let me
others.
interject. Let me interject a minute, Tim. That you bring up a good point, and hopefully we'll have a ton of your colleagues that'll be looking at this video.
Right.
And so the reason I wanted to interject is, in addition to the four main protocols that the NerveWave helps with, we also have for lack of a better word, a let's call it a fifth protocol, where it's that manual programming where you have your very common, tried and true STEM modalities, like TENS, like you mentioned, EMS, interferential, and so on. And there you can kind of customize it, for lack of a better word, cater it to your patient. It's manual programming, right? So you can mess around with it. It's not the presets that come with your four main protocols. So in addition to what we just mentioned, you have that additional feature of being able to manually program XYZ different STEM modalities. So thank you for bringing that up.
Yeah, you've got when you go into the one that says manual, you've got six different ones, like you said, TENS, EMS, interferential, microcurrent, Russian stem, galvanic. So what I've done is I've played around with it, and at first you're thinking, "Oh man, what's this thing going to do? Is it going to be shocking me and things of that nature?" So you can. It's very easy to control. Sometimes when I'm doing this, like I did on the gentleman I was talking about, and I would be working on him and say, "I'm going to let you control the knob just a little bit and go. If it's getting a little bit too much, let's go down." And so I'm using this on him, and I've used different protocols. The EMS seems to work real well through this one on him, but I've done interferential. I've done tens just to see how that does responds on me, and so I like this. This is an additional tool.
Well,
Then
I'm assuming, as you're doing the pickleball tour, this nerve wave comes in real handy.
it does, yeah. It's
So
going to
you
be.
bring it with you. You bring it with you on the circuit, man, and you set up a little booth, and there you go.
Yeah, I'm going to be playing a tournament down in Texas this weekend, so I'll let you know how that
Sweet,
goes.
sweet. So you kind of answered the next few questions that I had, but just to recap, some of the things I was curious about is you and your team. It seems like the nerve wave is pretty intuitive and easy to operate for you guys. And I don't want to put words into your mouth, but it sounds like that's what you're saying. So is the nerve wave pretty easy for you guys to operate, in the clinic?
It is, and I rarely do a therapy, but like on this particular guy, I was doing the gasha on him, but my staff totally handles it. We did an onboarding with you guys
Yep.
when we very first got it, but from there we've gone and used it on our own, and my staff can totally
Oh,
handle it.
sweet. No, that's awesome. I remember that. So that's fantastic to hear. Um,
Yeah.
and one of the other things I wanted to, ask you is in terms of the flow of your clinic. I know you guys are pretty busy. So how is it, implementing slash integrating the Nerve Spa? I got nerve on my brain, the NerveWave, pardon me. How has it been
Right.
implementing the NerveWave into into the flow of, your clinic's operation?
Yeah, it's very easy. It's just like adding another electrical therapy. If you're already using those in the clinic, then it's an easy step. It's a learning curve. Okay, you look at all the different programs you have, which ones you want to use
Mhm.
for what conditions. So there's a little bit of a learning curve there, but nothing that's very tough at all. And so it's easy to implement into the practice. And so we're using it with some other therapies for fibromyalgia. We're using the vagus nerve component. So you go down the program on your number 4 down on the list, you got the vagus nerve therapy. And under that, then you have 5 different programs you can choose from: the sleep insomnia 1, sleep insomnia 2, anxiety depression 1 and 2, and then the migraine vertigo. I've got probably half a dozen right now that we're using the vagus nerve stimulation on through the ear.
Right.
And the migraine vertigo is working really well.
Oh, sweet.
I've got a lady that, she comes in, these migraines are just killing me, and she's had neck surgery previously. And so once I told her about the nerve wave and the vagus stimulation, she said, well, I want to try that. And I think after, I'm going to say, 3 treatments,
Mhm.
she said, I can significantly tell a difference in
That's awesome.
my migraines.
Love it. That's
Uh,
fantastic. That's fantastic.
so, so that's an additional tool that most clinics are not going to have. This one and the Gaucha, uh, most clinics are not going to have the electrical component to that. So that's in addition to all the other programs that we have access to.
So I'm
So
curious because you mentioned this a little earlier because you have been doing this a hot minute, and I know when we have been chatting, you've got some other, let's call it capital slash clinical devices, in the clinic. So how does the nerve wave stack up to some of these other devices that that you've been using already in the clinic?
that's good. So yeah, uh, you know, we've got Hakamed, we've got the Matrix, electroanalgesia uh, by Neuromed, and so we've got some big, name and strong devices, and I
Right.
love those. What this is going to allow us to do, or what it's already allowing us to do, is have another modality to use on patients, because we're very busy with some of those other therapies. But it gives us another tool, and then the other thing is it is going to allow us to put it in the hands of a patient and allow them to do some things at home or on the go that um, that wouldn't be available. I mean, hey, everyone and their dog can get a TENS unit, okay? Um, but to have something that has some higher frequency, that has all the other components, the 7.83, let's spend a minute on that. When you go to the neuropathy protocol, and you've got your 3 phases: your primary, secondary, and your maintenance phase. So in there, you've got the 7.83,
Yeah.
which is kind of the secret sauce for some individuals on neuropathy. And so that's built into this. So you've got a patient now that can deal with joint type pain, muscle problems, neuropathy, vagus nerve, uh, fascia. So it's a very complete tool that we can put in the hands of a patient as well.
Well, first of all, thank you for that. And secondly, you touched upon something. I was just discussing this with somebody yesterday. You know, when we started developing this device, um, our vision for this was to have a premium protocol product that the patient can use at home.
Yeah.
That was our vision starting out of the gate, and to this day, that's our vision. It's gravy that you have had. such good use of the NerveWave, using it in the clinic as well. It just, reminded us that there was, additional pathways or business models that the NerveWave could help the clinic. But like I said, to your point, because there's so many different ways the NerveWave can help a patient, for them to have this at home, that's why that was our vision out of the gate. Uh,
Yeah.
so so Tim, I think I know the answer to this, but I kind of want to tie this all together. Um, and if it wasn't clear, tell me the nerve wave. I mean, have you been seeing good results? Have patients enjoyed using it? Has it, added a component to your clinic? And basically, is it helping your patients get better outcomes and feeling better?
Most definitely. Yeah. Here's the way that it goes in my clinic. Whether it's with an electrical therapy or nutrition, things of that nature,
Right.
if I'm not seeing positive results and response back, it doesn't stay in my office. And so for this to be in my office and stay in my office, that speaks volumes right there.
Sweet.
Um, and it's the same thing with nutrition. I've done clinical nutrition for well over 35 years. And so if I'm not seeing results across the board by a nutritional product, then it doesn't stay in my office. So yeah, we're getting results. We get good feedback. Just those two cases right there, where with this, the guy's seeing significant relief, um, and with migraine relief, with just those two cases alone, that's significant. And then all the others with the programs that are available in there, um, that are available through my other machines, that's just it's just gravy to have all these different protocols. And here's another thing:
Sure.
if I'm taking it home and using it,
That's
that ought to
true.
tell you that ought to tell you something. I mean, for goodness sake, I've taken some of these big machines, like I said, and loaded them in my truck and taken them home at times to use personally. I mean, I have access to it here at the office, but on the weekend, I like to have something. And so for me to take this unit home speaks volume, because I have confidence in what it can do.
Well, that's awesome. I'm glad to hear that. And we've talked enough times where I tell you, when if we're gonna, do some of these discussions, on video, that you're not beholden to me to say what I want to hear. And I know you well enough to know that you won't. So,
Correct.
thank you for doing this. And more to the point, I'm genuinely glad that the nerve wave is having a positive impact on your clinic. It's helping your patients, it's helping your team. Um, so it's probably the, for me, I don't want to overtalk the point. It's probably a great place to stop. So,
Well, let me say one more thing, and
yeah,
then
okay,
we can
go
stop.
ahead.
Is
Go
I
ahead.
appreciate you guys. Once I got this in early on, and you guys were getting feedback from me and other doctors across the United States, and then you've gone back to the drawing board, and you're tweaking it a little bit here and there to make sure that you make a great product even better. And so I appreciate you guys doing that. So I'm excited about what's coming,
Yeah,
in
so are
the
we.
future.
It's you and I have talked, in general, and overall, I dig, Nerve Spa and the products, and working with all the clinics. It's fun. And, you guys are in the weeds every day, and let's face it, we'd be, you know, quite frankly, a little bit foolish not to listen to what you guys are saying, especially it's coming from a good place, and we're partners. So, thank you for the feedback. I'm glad to listen. And, you know, the goal is to, help patients, and
Yes, I agree.
we do that together. So, thank you
Yes,
for saying that.
you're welcome.
So, all right, Tim. Well, listen, thank you again for your candid feedback, and I'm glad the NerveWave is helping your patients and your clinic. And we're just getting started, everybody, with product development. So it's exciting time
Yeah.
at NerveSpa. All right, Tim, hit him well in Texas.
All right. Thanks, Scott.
All right.
Talk to you later.
Yeah.